Okay, if you've been at the mall, perhaps you've been doing way too much walking, your feet are kind of hurting, you're not alone, but there could be a medical reason behind it. So great to welcome Dr. Nick Circolone with Apple Chiropractic, Orthopedics, and Physical Rehabilitation. Good to see you.
It's always great being here.
I love having you here. You're in your scrubs today. You've been down in Atlanta.
We've been down in Atlanta. We're doing manipulations under anesthesia. A whole nother show for that one.
Okay, we'll have you back for that one. Let's talk though about this foot pain, because you said that you see it an awful lot in runners, and this is a runner's town.
And not only runners, but people with plantar fasciitis pain. They've been diagnosed with plantar fasciitis. So basically what that is the bottom of the foot is that muscle and tendon that's in there that becomes inflamed and irritated. It's debilitating. People have
Yeah, because you can't walk.
No. They go months with pain, even with treatment. And some of the treatments that we do in our office, we do a combination of physical therapy and manipulative therapy, and we actually get in there and we work those muscles to break up the adhesion. See, the whole thing about muscles is they can have adhesions in them, which is basically fibrous tissue that kind of infiltrates the muscle and causes it to become stiff and extremely painful, because the bottom of the foot not only does it have all those muscles, but it has a lot of nerves. In the foot alone, we have 26 bones, just in the foot.
If you have, and it's called plantar fasciitis. Okay, if you have it, does it extend the length of your whole foot, or can it be kind of focused in just one area?
You can have pinpoint focus, but the plantar surface goes from basically right behind the toes to the heel.
Okay, does it tend to build up over time? So maybe you've just begun to notice a pain in your heel, let's say, but if you don't get it treated, will it then slowly spread throughout your foot?
Not necessarily. Usually when you have the plantar fasciitis, what some of the symptoms are is just excruciating pain when stepping on it, or going to run, or after a run, or before. When you wake up in the mornings, you'll find that it's extremely painful to step on. And sometimes people will walk it off and it'll feel better. But what they're doing is, if they put their running shoes on and they go running, what happens is they're doing micro trauma to that surface, which is causing some of that pain, and when they rest it is when it starts to get tight and tense.
Have you typically, the patient, seen a podiatrist before they come to you?
You know, they do, and what happens is they've seen other doctors, not just podiatrists. They've seen PTs, they've seen their family doctor, and sometimes what they'll do is they'll inject that area with a corticosteroid to decrease the inflammation. Very temporary. In some people. Some people it lasts, but most of the time it's very temporary.
Okay, so they come into your office, and did you tell me it can take about 3 months maybe to get this all squared away?
No, not necessarily. It's usually pretty quickly. I've had actually 2 patients in the past week that have had plantar fasciitis that basically have had it for about 3 months. And we took care of it within about 2 or 3 visits. Okay,
so they get there, and are they on a table literally and you're just massaging their feet, or are they doing some physical therapy, actively working?
A combination of everything. What we'll do is we'll assess the foot, we'll adjust it if we find misalignments in the foot, we'll work on those muscles and really get in there and decrease that inflammation and break up those adhesions. Actually, we'll cause a little bit of inflammation, and then we'll add some physical therapy modalities such as heat, ice, things like that.
Every runner's fear is that the doctor's going to say, you got to quit running.
And we see that a lot.
If you get this worked on and the fix is there, can you keep on running, or should you scale back and find another exercise?
No, once we get the muscles and the tendons and the bones and the whole joint working as a one unit, less chance of it happening again. No, go back to running and do what you're doing.
All right. See, he's quick. He and Jed are very similar. We're going to get you in, we're going to fix you, you're going to go live your life. Dr. Nick Circolone, Apple Chiropractic, Orthopedics, and Rehab on Shallowford Road. They're right there by the YMCA, 855-7376, applerehabgroup.com. Nick, good to see you.
Oh, it's always a pleasure.
We're back after this.